Okay, so thank you very much for your kind introduction, Professor Mills. Dear chairs, dear colleagues, my name is Anna Yufera, and I'm a research fellow at the Cardiovascular Research Institute in Basel. And today I'd like to present to you our work on the incremental value of glucose in the early diagnosis of acute myocardial infarction. It is no news for anyone here that acute myocardial infarction remains one of the major causes of death worldwide, despite all the improvements in its diagnosis and treatment. For this reason, its rapid diagnosis is critical, and also the rapid identification of low-risk patients is not only of great medical relevance, but it can also help us lower the costs in the ED and lower the length of stay of these patients. The algorithm for the triage of acute coronary syndrome recommended by the current guidelines includes clinical assessment, 12-lead ECG, and serial measurements of high-sensitive cardiac troponin. But it does not recommend the use of other biomarkers for diagnostic purposes. Other biomarkers may be used in order to obtain prognostic information. However, several studies have suggested that glucose as a widely available biomarker that is with a higher expression in stress situations and acute diseases might be of help for the early diagnosis of acute myocardial infarction. For example, Greenslade concluded that the use of high-sensitive cardiac troponin I and glucose was of help to lower the number of patients that needed further assessments in the ED and to lower the number of inpatients. Short came to a similar conclusion in his work published in 2017. For this reason, we aimed to test this hypothesis in a large multicenter study. For this, we also used the APACE study cohort, which is a prospective multicenter international study with the aim to improve the management of acute myocardial infarction. We recruited adult patients presenting to the emergency department with symptoms suggestive of acute myocardial infarction. The adjudication of the final diagnosis was performed centrally in the core laboratory according to the 4th universal definition of myocardial infarction. More specifically, 2 independent cardiologists reviewed all available medical records, including serial measurements of high-sensitive cardiac troponin, cardiac imaging, and follow-up data. For this analysis, we defined our primary endpoint as the diagnostic performance of the combination of glucose and high-sensitive cardiac troponin T and I when compared to just troponin alone for the early diagnosis of acute myocardial infarction. We assessed this by comparing the areas under the receive and operating curves. We defined our secondary endpoint as the prognostic value of glucose for all-cause mortality at 30 days and 2 years. We addressed this with a Cox regression where we modeled continuous variables used in restricted cubic splines in order not to impose linearity to continuous variables. For this analysis, we took all patients where a 0-hour value of high-sensitive troponin troponin I and glucose was available. This gave us a total of 5,639 patients eligible for this analysis. Now going to the results, we first wanted to take a look at the distribution of glucose in our different diagnostic groups, from left to right: acute myocardial infarction, unstable angina, cardiac but not coronary reason, non-cardiac, and unknown. As you can see, there is an overlap in most of the diagnostic groups, with a bigger difference, of course, in the group of patients that ended up having an acute myocardial infarction and those ones that ended up with a non-cardiac diagnosis. This is in line with the findings we saw in our ROC curves. As you can see, glucose, which is represented by the green line, had a low discrimination for the diagnosis of acute myocardial infarction, not surprising, with an area under the curve of 0.4. A much bigger diagnostic accuracy was seen for both high-sensitive cardiac troponin T and I alone, but most importantly, when adding glucose to both of the high-sensitive cardiac troponin assays, the diagnostic performance was not better. Similar findings were obtained when looking at our subgroup of early presenters. Now let's move on to our prognostic outcome. Here you can see a dosage response plot which is showing the results of our Cox regression for our outcome of 30-day all-cause mortality. So here on the x-axis, you can see the glucose concentrations. In the box plot, you can only see the distribution in our population. So it is important to note that 75% of our patients had values of glucose between 5.4 and 7.2 millimole liter. On the x-axis, on the y-axis, you can see the Hazor ratio, and the red dotted line represents our reference point, which was defined as 5.6 millimole liter, which is the American Diabetes Association cutoff for impaired fasting glycemia. So the main thing you can see in this figure is that you can see the Hazor ratio for every single glucose value. In this case, we observe that from a value of 6.5 millimole liter, there is a statistically significant higher risk for all-cause mortality. The values used to adjust the models were defined based, using previous literature research and based on matter-based knowledge. As you can see, for our all-cause mortality outcome at 30 days, at 2 years, we obtained very similar results. Of course, like all studies, we have some limitations to report. First of all, we have no information on the fasting status of the glucose values used for this analysis, so there might have been some values that were over the normal cutoff due to postprandial measurements. This study was conducted in patients that came to the ED, so in an ED setting, and we cannot comment on the performance of glucose in different clinical settings. And third, these findings cannot be generalized to patients requiring dialysis, since they were not included in this study. Now, to sum up, our findings were in line with the current guidelines. Glucose did not improve the diagnostic performance of high-sensitive cardiac troponin T or I for the diagnosis of acute myocardial infarction when studied as continuous variables. When used in early presenters, glucose also failed to improve the diagnostic accuracy of both high-sensitive cardiac troponin T and I. And finally, glucose is a prognostic factor for all-cause mortality at both 30 days and 2 years for patients presenting to the ED with suspected acute myocardial infarction. Thank you very much for your attention. And maybe anticipating the question of Professor Mills, we did not study also for outcome type 1 and type 2 myocardial infarction. However, it's a great suggestion that we will for sure take into account.
I'm that predictable. So I was going to ask you, in addition to that question, were you surprised by your findings, but in terms of its diagnostic performance?
Not really. I mean, I guess the main added value of all new biomarkers or older biomarkers that may be considered now for acute myocardial infarction is more for the group of early presenters, which is still the group of patients where we are in the moment not able to make a quick rule out. For all other patients, I think, it's just as you said before, it is very difficult to beat troponin.
So you're familiar with Pete Kavsak's work in this area, you combining glucose and creatinine and troponin as a triple rule-out strategy. Have you looked at that in your cohort?
Well, I am familiar with the results, but we did not see this in our cohort. But again, thank you for the suggestion. It is, of course, something we can take a look at.
Okay, one last question if we've got... Those are excellent. I will pass the microphone to Oscar.
I don't hear it.
Nice presentation. And just one question. Have you compared the curves of glucose in terms of prognostic factors in diabetic and non-diabetic patients? Because I'm thinking in other circumstances, a rising in glucose is a better marker of worse prognosis in non-diabetic patients rather than the diabetics. Are you looking at that? I mean the restricted spline curves.
No, that we did not look for their prognostic outcome. No, we did not look for that. But again, great suggestion.
Okay, to try and keep on time, thank you very much, Anna. That was a really interesting presentation.